Good morning. In my last video session, we were discussed up to choice of the proverb. Today, first of all, let us see the method of preparation of drug for brewing. When we prepare indigenous plants, that is native plants, it should be administered in the form of freshly expressed juice, and it is mixed with a little quantity of alcohol. The alcohol will help to prevent decaying of the medicinal substances. In the case of exotic vegetable substances, we must be rendered in the form of powder. For preparing tinctures from the exotic vegetable substances, we should add some amount of alcohol when they are in the fresh state, and afterwards we mix it with a certain proportion of water. And in the case of salt and gums, it should be dissolved in water just before being taken. In case of dry plants, especially herbs, it should be cut into small pieces, and an infusion is made by pouring boiling water on it and consume it while still warm. Now, look into the dose and mode of administration of medicine for brewing. In the case of strong heroic medicines, they are labeled even in small dose to produce changes in the healthy human being, even in robust persons. So adjust the dose accordingly. The medicine having milder heroic power must be given in more considerable quantities. In case of weakest medicines, it should be brewed on healthy, delicate, irritable, sensitive persons. Those are free from disease, and in this case we should be given the medicine in large quantities. The potentized medicine should be given to the brewer on empty stomach daily from 4 to 6 globules of the 30th potency moistened with a little water for several days. Now let us see about the mode of administration. The medicine should be given in an empty stomach, and it should be given daily for several days. The dose should be regulated as 4 to 6 globules of 30th potency, that is moistened with a little amount of water. If the drug produces only a slight effects, a few more globules may be taken daily till the effects become more prominent. You should start the brewing with a small dose of drug and gradually increase that dose day by day. Actually, only potentized medicine should be employed for brewing purposes, because the crude drugs substances, when administered for brewing, it does not give an idea about the full amount of signs and symptoms. Many of the properties of drug remain in dormant or hidden form. But by potentization, the latent curative power of drug are developed and aroused into activity to an incredible extent. Potentization brings medicine to the dynamic state so that it can act on the dynamic plane. When the potentized medicine applied upon healthy organism, it produces common dynamic symptoms which help to distinguish from one case to another. If the effects of the dose are slight, a few more globules may be taken daily until they become more distinct, stronger, and the alterations of the health. Now let's see how the symptoms are recording. The symptom producers by primary actions of all medicines are recorded except narcotics. In the case of narcotic substances, symptoms of secondary action should be recorded. Some drugs produces alternative actions and all which should be recorded. To determine the exact character of the symptoms, the modalities should be recorded. Modality means any increase or decrease of the symptoms with the time, position, weather, etc. Any alteration from normal health should also be recorded. Actually, proving on sick person is not recommended. If the proving is conducted on the sick person, the symptoms of his disease condition should be closely watched. If there are any new symptoms appeared, it may be belong to the given medicines. That also recorded. Now, let us see how to note the symptoms. If the prover is illiterate, if the prover is literate, he must note down the sensation, his sufferings, and the changes of health he experiences at the time of after the injection of the drug. The physician looks over the report in the presence of the experimenter immediately after the experiment is conducted. If trial lasts for several days, the physician does this every day. In case of the prover may be illiterate, the physician should inquire every day concerning the nature of symptoms and the manner of their appearance. The physician must note his sensation chiefly from voluntary narration without asking any leading questions. Now, when the physician himself is a prover, his recording of symptoms will be more accurate. Now let us see what are the advantages of the physician himself as a prover. The physician knows with the greatest certainty the things he has experienced. The physician can confirm the quality of the medicines he used for proving. And these experiments on himself promise to give him a reliable knowledge of the true value and the significance of the instruments of cure. A well-conducted drug proving never produces any injurious effects on the health of the prover. On the contrary, the body of the prover becomes more resistant to disease by removing external malefic influences. His health becomes more unalterable and he becomes more robust. Moreover, immune power is greatly increased against all kinds of infections. These are the advantages of the physician himself as a prover. So, let me conclude for today and I will come again on tomorrow with the remaining portions. Until then, goodbye. Thank you.